Welcome to another edition of Three Things in Biotech, a daily digest dedicated to helping you keep pace with the fast-moving world of pharmaceutical and biotechnology research. Roche goes for a knockout with positive triple-negative data. Company, Roche OTCQX, RHHBF, OTCQX, RHHBY, therapy, Atezolizumab Disease, breast cancer news. RHHBF announced positive top-line data from its IMpassion 130 study, a phase 3, randomized trial evaluating the benefit of the PD-L1 inhibitor Atezolizumab, Tecentriq, in combination with Celgene's CELG, nab-paclitaxel, Abraxane, in women with triple-negative breast cancer. As it turns out, the combo significantly reduced the risk of progression, both in the overall population as well as in patients with higher PD-L1 expression. Looking forward, while we do not have the full data set or the overall survival results, this is highly encouraging for RHHBF, which has made two groundbreaking discoveries in as many weeks. First, small cell lung, and now triple-negative breast cancer. These are two major areas of unmet need that had weak evidence for the benefit of immune checkpoint inhibition when used alone. It seems that comboing is the way to go, and it gives RHHBF a few opportunities to really stand out among the pack. Buy, sell, or hold? Many people want the quick answers about buying, selling, and trading in general. Get the answer today by becoming a subscriber of the Total Pharma Tracker. New link hanging on and providing small updates in the aerospace company, New Link Genetics Corporation, NLNK, therapy, Indoximab disease, diffuse intrinsic pontine glioma, DIPG, news, NLNK announced an update to its phase 1 trial involving the combination of its CETO inhibitor Indoximab with radiation and chemotherapy for pediatric patients with DIPG. These findings were presented at the International Symposium of Pediatric Neuro-Oncology annual meeting. The DIPG patients represent just one cohort of a larger phase 1 trial. 10 patients have been enrolled so far, and all 10 demonstrated improvement in their neurological symptoms. The first 2 patients achieved an objective response. Looking forward, first, a disclaimer. These data are very early, with the longest time on study being just 8.5 months. But it is encouraging that all the patients are achieving some alleviation of symptoms. For now, we don't know whether this is translating into tumor control, as would be expected in around 70% of patients with DIPG. However, this is an encouraging first look, and interested viewers will want to watch every Indoximab-related trial very closely. Buy, sell, or hold? TPT members find out today. RHHBY sticks the landing in schizophrenia. Company, RHHBY, ALKS, therapy, aripiprazole disease, schizophrenia news. ALKS announced that its atypical antipsychotic agent, aripiprazole, branded ARISTADA Initio, has been granted supplemental approval in the treatment of schizophrenia in adult patients. The drug is a new formulation of the approved drug ARISTADA, allowing it to act as a long-acting release for infrequent dosing. Looking forward, considering this approval builds on an already approved drug but in a new formulation, this news won't likely have a major impact on ALKS in the very short term. However, these kinds of authorizations are the bread and butter for an established product, allowing the expansion of sales. In particular, with improvement in the pharmacokinetics, ALKS can potentially extend the treatment to a wider range of patients. Buy, sell, or hold? TPT members find out today. Author's note: thank you for taking some time out of your day to read some commentary on recent biotech happenings. I hope you'll consider leaving a comment or a question in the section below. This is one way in which Seeking Alpha is able to gauge the effectiveness of its writers and the platform. So if you want to keep seeing more editions of Three Things, go ahead and participate. Disclosure: we have no positions in any stocks mentioned, and no plans to initiate any positions within the next 72 hours. I wrote this article myself, and it expresses my own opinions. I am not receiving compensation for it, other than from Seeking Alpha. I have no business relationship with any company whose stock is mentioned in this article. Editor's note: this article discusses one or more securities that do not trade on a major U.S. exchange. Please be aware of the risks associated with these stocks.